Hello, my name is Luis Cifuentes and this is my presentation on sleep disorders. Sleep disorders are conditions that result in changes in the way that you sleep. Sleep disorders can affect your overall health, safety, and quality of life. It affects it by it affects these abilities to focus on your day-to-day life. There are many different types of sleep disorders, but they're all categorized into 7 different types of disorders. There are many ways to diagnose sleeping disorders, but for more information, always ask your doctors. Most sleeping disorders are usually easily treatable once a doctor effectively figures out the correct diagnosis of your disorder. Some facts about sleep disorders: as many as 50 to 7 million Americans have a sleep disorder of some sort that affects them in their day-to-day life. Either they know about it or they don't. More than 50 conditions are classified or can be grouped into classifications of sleep disorders. Sleep disorders are not considered to be sleep disorders until you show that you have no control over the circumstances of why you can't sleep. The two most common sleep disorders is insomnia and obstructive sleep apnea. High blood pressure, diabetes, and heart diseases have all been linked to sleep disorders. Short-term memory loss can also suffer with sleep deprivation. Sleep disorders can be connected with other disorders. For example, depression carries also anxiety, carries insomnia, doesn't let you sleep. So these are some of the most important facts about sleep disorders. The types of sleep disorders are insomnia, sleep-related breathing disorders, central disorders of hypersomnolence, circadian rhythm sleep-wake disorders, parasomnia, and sleep-related movement disorders. And the last classification is uh, all of the above, pretty much. There are 7 classifications. So the first one is insomnia. The most common sleeping disorder falls into 2 categories: trouble falling asleep and difficulty maintaining sleep through the night. Uh, the symptoms for this disorder are difficulty falling or staying asleep, early morning awakening. Uh, it could take patients an hour or more to fall asleep initially or after waking multiple times during the night. Fatigue, moodiness, irritability, and reduced concentration or any type of focus throughout the times of periods where you're supposed to be asleep. Sleep-related breathing disorders, which this disorder usually goes with obstructive sleep apnea. This apnea are periods where your throat muscles that normally hold the airway open during the sleep uh, that usually fail to do so, causing the airway to collapse. These episodes can occur more than one time during the night and even hundreds of times. The symptoms are usually, if you snore is a main symptom. So if you don't snore, then you do not have apnea. Uh, the more louder you snore, the more you're closer to having sleep apnea. Mhm. Other symptoms are short of breath, tiredness creeps in during the day. Central disorders of hypersomnolence, which has to do with narcolepsy. Narcolepsy is excessive sleepiness. Uh, Narcolepsy is when people have trouble staying awake and are alert during the day, which affects their functions at work or school. Uh, some of the symptoms are extreme daytime sleepiness and feeling tired, although you had full night sleeps, are the standard symptoms. Vivid hallucinations and momentary feeling of paralysis can occur as you fall asleep or awaken. Some people have narcolepsy with catalepsy or a sudden loss of muscle tone. With catalepsy, you have a brief period of partial or complete paralysis of your muscles while you're awake. Circadian rhythm sleep-wake disorders, conditions that temporarily or routinely go against the body normal biological clock of being active during the day and sleeping at night, or differing from a custom sleep patterns. It's pretty much when you have a weird schedule of sleep where you usually don't sleep during the night, but you sleep during the day and you're active during the night. Uh, Parasomnia. Unusual nighttime behaviors such as sleepwalking, night terrors, sleep paralysis, and REM sleep behavior disorder are common examples. Some of the symptoms are just weird behaviors during while you sleep. So if you have a lot of night terrors, or you always have paralysis during sleep, if you wake up in weird hours, not conscious, and you're walking, that's sleepwalking. That one's pretty self-explanatory. Parasomnia, unusual nighttime, sleep-related movement disorders, usually has to do with RLS, or restless leg syndrome, uh, which it just relates with activity and uncomfortable leg sensations can prevent you from falling asleep. So any type of movement so that doesn't let you sleep. So like there's times where like people just can't sleep. Most of the time, they have to be doing something, or they're always moving, they're always active, and prevents them from having good sleep. And other sleeping disorders, or all of the above, it's pretty much all of the other disorders that don't fall into the 6 other categories. For example, sundowning is when people with dementia become more confused in the evening after leading to sleep disruption. Another one of them that I want to talk to is REM sleep behavior, which falls into parasomnia. Oh, yeah, parasomnia. REM sleep behavior disorder usually occurs in older males. People act out vivid dreams during REM sleep. People may kick, punch, or bang their heads against the wall, and this one can injure them. It can also cause injuries. The diagnosis is pretty similar to all sleeping disorders, as the board goes. If you have ongoing sleep problems, your primary care provider may refer you to a sleep medicine specialist or sleep center. They will give you physical exams and sleeping questionnaires. If the results show that you are having sleep problems due to obvious medical issues, then you will be sent to a right specialist to get it checked. However, if a condition like obstructive sleep apnea is suspected, or any other sleeping disorder, your doctor may recommend you that you have an overnight sleep testing, in which they would monitor brainwave recordings, heart speed rate rhythm, blood oxygen breathing patterns, including apnea and eye limb movements. After assessing the information, you will be asked to get further testing to effectively figure out the best way to help you assess the next steps to help you. Most sleep disorders are successfully treatable if you're treated properly. So always get checked. Causes of sleeping disorders. Most causes are pretty self-explanatory. It's age, medical condition, chemical imbalancing, genetics are the most common categories. Age varies through each one. So like for children, they're more likely to suffer sleepwalking. Medical conditions are usually like I was previously saying, most sleeping disorders have a correlation with other disorders like depression and anxiety, have a correlation with insomnia, or a physical pain that can obstruct you from being able to sleep. So like if you break your leg and it hurts, you're not going to be able to sleep. A certain medication given to you can also cause you to have insomnia or other sleeping disorders. Chemical imbalancing can have you can provide you a struggle in falling asleep. Genetics can also cause you not to be able to sleep. But like I said, the most important one is that sleep is relative to other disorders as well. So this means if you have a disorder already in which you suffer from depression or anxiety, you are likely to have insomnia with it. So pay attention. Those affected by sleep disorders, you have to take these precautions very seriously. Sleep disorders can affect anybody without even realizing that you have this disorder. Other disorders like ADHD, depression, or anxiety can have an effect on sleeping, thus causing you to get sleep disorders. If you take prescription drugs, you are likely to build a sleep disorder. Sleepwalking mostly affects children, but if not treated properly from an early stage, you can carry it to adulthood. REM sleep behavior disorder usually affects older people. Doesn't mean it won't affect you. You are more likely to build bad sleeping habits the more you stress, but if you're not corrected properly, it can become a disorder. The effects of sleep disorders on society. Sleep disorders can become serious if not treated or addressed properly in extreme cases. Not letting you function properly on a day-to-day basis can affect you in your life. If you aren't getting enough sleep, you are more fatigued through the day. Thus, you can fall asleep while driving, or some other accidents can occur. Sleep disorders can affect your work in a job or school, not being able to focus because of the lack of sleep. Unusual sleep patterns can also affect the people around you, not letting people get good amount of sleep. Sleep is important for everybody. If you aren't getting enough sleep, you can seriously be at risk of sleep deprivation. Treatment. If you are diagnosed with sleep disorders, treatments may include medication alone, nighttime devices, surgical procedures, or lifestyle measures. Insomnia, you always have to take medication, but always be careful with the medication because you could be susceptible to addiction. Cognitive behavioral therapy is also a type of relaxing training that will help you manage insomnia or other sleeping disorders. Obstructive sleep apnea is very unique, which they give you a machine that is called the continuous positive airway pressure. It's CPAP, which is a machine that is pretty much put in your mouth that will let air flow through your tubes of your body. Narcolepsy is very important to know that there's no cure for it, but there's also medication that could help you with symptoms. Restless leg syndrome. Use of iron supplementation is associated, with RLS. Also, medication, self-care strategies such as daily exercise, avoiding alcohol, and stretching or massaging your legs before bed can help as well. The responsibility as a patient to combat sleep disorders is very important. First and foremost, if you experience any type of symptoms in the categories of sleeping disorders, get help immediately to address the right treatment for the disorder. Follow instructions to the best of your ability to help you figure out how to sleep better. Follow good sleeping habits, for example, sleeping early if needed to. Take a nap if you feel very tired, or have better sleep hygiene. Don't make it hard for the people around you who are also trying to sleep. Get the help that is needed to ensure good sleeping habits. And this is the conclusion of my presentation.